Good afternoon, this is Dr. McDaniel. It's Friday, July 5th, and continuing on treatment options or management for cervical precancer changes. So previously I spoke about the treatment or the management for early precancer changes. We call that low-grade SIL or LGSIL, low-grade squamous intraepithelial lesion, used to be called CIN 1 and 2, or mild dysplasia. Severe precancerous changes are called high-grade SIL, HGSIL, high-grade squamous intraepithelial lesion. Sorry, I have sniffles today. Or severe dysplasia, used to be called CIN 2 with glandular involvement, or CIN 3. So the pap smear is the predominant means of preventing cervical cancer. I have some previous episodes going into details on the pap smear. And once the pap smear detects that there's the potential for precancerous changes or abnormal, sorry, I'm having technical difficulties today, abnormal cervical changes, then a diagnostic test is performed that's called a colposcopy with biopsies. It used to be acceptable to just do the colposcopy without a biopsy, but now, and now means like in the last 15 to 20 years, it's really not acceptable to do the colposcopy without biopsies, because the studies have shown that even if under magnification with the colposcope everything looks normal, 65% of the time on average there are precancerous changes that just aren't obviously detectable under magnification, so grossly with the naked eye. So it still warrants a biopsy for a pathologic confirmation. So you do a biopsy, the pathology doctors will look at the biopsy under microscopic means, and they'll be able to tell you if the tissue is abnormal or no. So the colposcope is a diagnostic test, and its value is in directing the physician to the areas most likely to harbor abnormal or precancerous changes. Biopsies are obtained from those areas. Once the biopsy obtained and the pathology doctor has given their diagnosis, if the diagnosis comes back with early or mild changes, then the option for treatment or no treatment is given. So we call that active versus conservative management. Active management is an exfoliation process called cryotherapy or cryoablation. The conservative management is not doing anything but monitoring with pap smears to see if the cervix resolves or normalizes on its own. Without treatment, approximately 65% of women will normalize on their own within a 2-year time frame. With the treatment, about 80 to 85% of women will normalize on their own. Statistically, there isn't a large enough difference between those two groups to push women one way or the other, so that's why everyone has an option. I know some physicians don't give the option. They just say, nothing to do, come back in 6 months, we'll repeat the pap smear, or even come back in a year, we'll repeat the pap smear. I think it's always best to give people an option so that they can do what they're most comfortable with. We're not supposed to be paternalistic as physicians. Years ago it was fine to be paternalistic. I mean, physicians used to not even tell certain patients that they had cancer if they felt the patient couldn't emotionally handle it. They would tell their loved one and not tell the patient she has cancer. But we're not supposed to do that anymore. So we're supposed to give informed consent, informed discussion of the results, and informed discussion of their options for management, and then they decide what they want to do. They can do nothing or they can do something. If the biopsy from the colposcopy comes back suspicious for severe or high-grade changes, then a treatment is always recommended, because there's a cushion between mild changes and cancer, and that cushion is high-grade changes or severe precancer changes. There isn't a cushion between severe precancer, high-grade changes, and cervical cancer, so we always recommend treatment, and the treatment is a cone biopsy. The cone biopsy is a complete removal of all the pathologic appearing tissue under colposcopy, and then that tissue is evaluated by the pathology doctors to confirm if all of the tissue contained the abnormal cells that were previously diagnosed, if anything was missed, if it confirms the diagnosis, if it confirms there really were just precancerous changes, no areas of early cancer, and it's the treatment because we're completely removing all the pathology. Now, the doctors in the pathology lab will always confirm if the edges of the cone biopsy were completely normal, because if the edges are normal, then that means what's left in the cervix is normal. If the edges show abnormal changes, then we don't know if the edges were just where the abnormal cells were still present and it was still completely removed from the cervix, or if there's a little bit from the edge on the border that's left in the cervix that's still abnormal. So the cone biopsy, basically when we look at the cervix, it looks like a donut. The cone biopsy is a circular excision or removal of all of the pathologic tissue within that cone-shaped amount. So when we used to do the cone biopsies only with a scalpel, we would bevel the scalpel in, so we would torque it in. So when we remove the tissue from the center of that donut, it looked like a dunce cap or a cone. And it's called a biopsy because we're not removing the whole cervix, we're just removing a portion of it. So when we do it with a scalpel, we call that a cold knife cone biopsy. Over the years, we've gone through a series of changes. So it went from the cold knife or the scalpel removal to laser. And the laser was only done briefly because the laser is just a form of cutting. We couldn't do the laser in the office, so we had to always bring everyone to day surgery. So that kind of fell out of favor pretty quickly. It got replaced with electricity. Excuse me. The electricity has its own name. It's called a loop electrode excision process. It's a very, very thin wire called a tungsten wire loop. And that loop is used to remove that inner cervical abnormal tissue changes that's seen under colposcopy in layers. So it's like you take an ice cream cone and you lop off in layers all the way down to the bottom of that cone. That's how we do the cone biopsy as a treatment. It's a treatment and it's a confirmation of the diagnosis, and it's a confirmation that there aren't any early precancerous changes and that there isn't any abnormal or precancerous changes left in the cervix. So we call the loop electrode excision process a LEEP. And the LEEP is a treatment for severe or high-grade changes. I'll continue that mode of thought and discussion tomorrow, Saturday, from the farm. We have horse lessons tomorrow, back in the old routine. So I hope that's been helpful. We'll continue this line of information tomorrow. It's Friday, TGIF, July 5th, 2019. Please check out the YouTube channel. It's also GYN Corner. Like, subscribe, and comment, as everyone says. Have a great rest of the day. See you on the weekend. Bye.